Hi everyone, I'm Diana, a certified HelloRache virtual assistant. I work with an internal medicine doctor and part of my job is helping patients through a program called Chronic Care Management or CCM. Every month I call patients who have chronic conditions like high blood pressure, diabetes, or heart disease. These check-ins help us make sure they're doing okay and getting the support they need between doctor visits. In this vlog, I'll talk about what CCM is, what I do during these monthly calls, and how it helps patients take better care of their health. Stick around to see how we give patients extra care beyond the clinic. Okay, so let's be honest. Not every patient is in the mood for a call. Some get confused or even frustrated. So in this vlog, I want to walk you through how I handle these situations with care and professionalism. So step one, acknowledge their feelings. Tayong mga healthcare virtual assistants, alam natin to, number one talaga to. So start by showing empathy and acknowledging their frustration. I usually say, for example, I'm just going to use my husband's name. So Mr. John, I understand this might feel frustrating and I truly appreciate you taking the time to speak with me today. So that's very important. Number two, step two, reassure and explain the purpose clearly. So I remind the patient why I'm calling and how the program helps them. So, hi, Mr. John. Again, this is Diana calling from Dr. Ethan's clinic, and I was instructed by a doctor to reach out to you or to patients as part of our chronic care management program. And this program is designed to support you with your ongoing health needs, such as medication management, appointment coordination, and providing help between visits. So this call is part of that ongoing support and typically takes about 20 to 30 minutes. So I'd love to find a time that works best for you. Please let me know if you're available now or when would be a good time for me to call you back. So yeah, kailangan sabihin ano yung purpose mo. Masabi mo yung talagang kahalagahan ng call na yon, na hindi lang siya sales call, talagang support call siya. So very, very important yon. Sinasabi ko rin talaga, ako technique ko yon. I tell them talaga gano'ng katagal yung aabutin nun. So, pag nalaman naman nila yung purpose, okay sa kanila. Pero again, hindi lahat ng patients like okay sa ganyan. Yung iba hindi maintindihan. So, unawain lang. Lalo na pag CCM, usually matatanda yung patients dito talaga. Karamihan, yeah. Plus, I also say, I just want to check if you're doing okay and see if there's anything you need or anything we can do to help. So, gustong-gusto nila yun. So, alam nyo, kahit na sabihin yung tawag lang yun, napakaraming needs ng patients. Lalo na yung talagang madaming sakit. Yeah. So, step 3, give them control. A lot of frustration comes from feeling forced. So I offer the patient control of the call. How do I do this? Mr. John, if this isn't a good time, we can reschedule. I just want to make sure you're comfortable and that this works for you. Or, Mr. John, would you like me to continue now or find a better time to talk? So that is after I of course, inform them about the purpose of my call. Tapos yung iba parang, ano pa yan, magpo-pause, parang ayaw pa, hindi sure. So step 4, stay calm and positive regardless of their tone. Even if the patient stays irritated, I keep calm and respectful. Mr. John, I completely understand that. Thank you for letting me know. I'll go ahead and note your preference and we'll make sure to reach out at a time that works better or not at all if that's what you prefer. So yeah, that is very important. Give them control. Okay, so if the patient calms down or is willing to continue, good job. So, Mr. John, thank you. I just need to ask questions to make sure everything's going well for you, and I'll note anything you'd like us to follow up on. So, if the patient still doesn't want the call, Mr. John, no problem at all. I'll go ahead and update your file so we don't continue these calls unless you request them. Your comfort is important, and we're here if you ever need support in the future. So yeah, so key points to remember, guys. Never argue or talk over the patient. Use a soothing tone and short, clear explanations. Stay calm, even if the patient is upset. Document the interaction properly. For example, patient expressed irritation, offered to reschedule. Patient declined continuation of CCM call. Always give the patient control and respect their choice. Okay, so that's how I handle difficult CCM calls. It's all about staying calm, being kind, and making the patient feel heard and respected. If you're also doing CCM work or thinking about becoming a virtual assistant in healthcare, I hope this gave you some helpful insight. This is just my personal approach to CCM, but I know each of us has our own style when it comes to supporting patients. I'd love to hear how you handle your CCM calls too. Feel free to share your thoughts or suggestions in the comments. Let's learn from each other. So thank you so much for watching, and I'll see you in the next vlog. Yun yung mga bagay naman na tinatanong ko na. So pag pumayag na sila, go, go, go na. Yun yung mga tinatanong ko sa CCM calls ko. So, isi-share ko din yun sa part 2. Masyado nang mahaba tong part 1. So, thank you again, guys. Bye!